Okay, this is a video to show you how to prepare for a wellness screening. The first step is to test the meter by using a control solution. And that is the test solution we're putting on the test strip. It should give us a reading.
121.
121, which is on the test strip bottle, should read 116 to 149, and that is normal.
Hi Jimmy, I'm Julia. I'm a student pharmacist here at Ohio State. I'm going to be taking your blood sugar and then your blood pressure and then getting your BMI.
Okay.
Are you ready to get started?
Let's go.
Okay.
We want to make sure that we prick on the side of the finger because that is less painful for the patient. And don't be afraid to squeeze to get the amount of blood you need. When testing with the test strip, make sure to place it at an angle of 45 degrees to get the accurate reading.
Great, your blood sugar is 86.
After placing the sharps in the sharps container, pack up everything, roll it into a ball, and fold it into the gloves and dispose of it before beginning the blood pressure testing. Now we want to make sure that both feet of the patient are on the ground.
Could you please uncross your legs?
We also want to tell the patient not to talk while we perform the blood pressure measurements.
Could I ask you not to talk while I take your blood pressure reading just to make sure that there's not an inaccurate result?
Sure.
Before beginning the test, we want to pick the right cuff size to prevent inaccurate reading. We want to align the cuff tube with the brachial artery. And we also want to make sure that the arm is also aligned with the heart.
That's fine, thank you.
If you get an error message or an abnormally high value, we want to retest again with the manual blood pressure.
Do you mind if I retest you manually just to make sure that these results are accurate?
No, go ahead.
We want to have the earpiece pointing towards the nose. Then we will put it on. We also want to make sure that the face of the diaphragm is open. For the manual, the cuff technique is the same to the automatic. We want to make sure that the valve is turned clockwise all the way and slowly released counterclockwise to release air. So the third part of the screening is the weight evaluation based on BMI and percent fat. So we're going to show you how to use the scale. First, you're going to turn it on the side. That turns it on. Then the next thing you're going to do is hit guessed memory. And it asks you for the patient's age. You can use the arrows on both sides to put in the patient's age. When the age is determined, you're going to press set. It asks you if the patient is male or female. You're going to use the arrow again, and you're going to press set. And it asks you for the patient's height. You can ask the patient their height, or you can measure it using the tape meter provided for you. Then press set. Then you're going to wait about 2 seconds. It should show count. You're going to have the patient step on the scale without any shoes or any socks, bare feet. And once they step on the scale, it should give a reading for the BMI and percent body fat. Thanks for watching and hope you enjoy your screenings.